Okay. Welcome to our webinar, Child Abuse Prevention, State of the Science. This webinar is presented by CalTrin in partnership with the California Evidence-Based Clearinghouse in honor of Child Abuse Prevention Month. We have several goals for today's webinar. First, I'll introduce CalTrin and our role in supporting child abuse prevention. Next, we'll take a look at the purpose of Child Abuse Prevention Month, how it can call attention to this issue, as well as focus commitment and action within your community and your organization. And finally, we'll review what the science tells us about how to best prevent child abuse, including strategies and underlying approaches. CalTrin is a program funded by the California Department of Social Services Office of Child Abuse Prevention. It provides free training to family-serving professionals within the state of California. We began providing training at the start of this year, so we're pretty new. Our mission is to provide professional development that is relevant to your daily work, and we're excited to already get to know many of you, your organizations, and the communities you serve. But today we'd like to tell you a bit more about us. Again, my name is Dana Jarzinka, and I am one of the training coordinators with CalTrin. I'd also like to introduce my training counterpart, Jess Matley. Jess, you want to give a wave? Many of you have previously met Jess as she hosted our Trauma-Informed Systems series with Dr. Melissa Bernstein over the last 2 months. I'll be introducing CalTrin's director and today's featured presenter, Jennifer Rolls-Roots, in just a few moments. CalTrin's home is the Chadwick Center for Children and Families at Rady Children's Hospital, San Diego. As CalTrin's training team, Jess and I are both passionate about increasing access to high-quality evidence-based training. For those of you joining us from other states and countries, we're also very glad to have you with us. The past year or so has brought so much change, but one surprising positive has been greater opportunities for connection with all of you. Together, we support family resource centers, child abuse prevention councils, and other family-serving organizations throughout California, and ensure that our training meets diverse needs throughout the state. This means planning training that works for small FRCs, as well as very large organizations with comprehensive training programs, rural and urban programs, and those with an incredible diversity of services. While many of our training events are provided to professionals across California, our outreach efforts are linked to 5 regions identified on this slide. In our outreach roles as staff, our goal is to make sure that FRCs and child abuse prevention councils have information about upcoming training. But we also want to connect with you to ensure that we're meeting region-specific needs. So I support the Southern and Central Valley regions of the state, while Jess supports the Northern, Bay, and Mountain Valley regions. If you are participating from California, you'd please take a moment to add your region to the chat, and we'd be delighted if you'd also drop us a note at any point. We'd love to hear from you. I want to personally say welcome, and we both hope to connect with you more in the future. We're always excited to hear about the work you're doing and any suggestions you have for how we can improve or the types of training that we're offering. So we've got Central Valley, Mountain Valley, Northern California, and Lassen County. The Southern region, more central, Santa Barbara, Ventura. I'm so happy to see what a great representation we have across the state today. This is fantastic. We've got Sonoma, look at these come. We've got Mountain Valley, Monterey, more San Diego, that's great. LA. So you can see that there are a lot of people who've joined over from across the state to celebrate Child Abuse Prevention Month with us today. And we're really happy to see that. And we really hope to keep this connection going, not only today or across the month, but to really keep this interconnectedness with each other, because it really does benefit all organizations to share information like this. Wow, and I can see we've got some folks from around the country as well. New York, thanks for joining us. It's a little later in the day. Arizona, wonderful. So I'd like to tell you a little bit more about CalTrin. We are excited to support organizations in their efforts to prevent child abuse by providing you with access to free training. It's always free, as well as resources. So this is going to include live webinars, online self-paced courses, job aids and other types of resources, and some unique professional development opportunities that are a bit more interactive. Our training is for everyone, but information is tailored to meet the unique needs of staff in various roles and responsibilities. So this means that we will note in the training schedule who the training will benefit most and whether registration will be limited to a particular group. So for example, a training might be specifically for leadership or specific to a group of people in a particular region. And you will see that again on our training schedule. Even though our training is free, you will benefit most if you make a small investment on your part. What I mean by this is that we aim to connect, to help you connect at a meaningful level. And so for each training, we'd like you to watch for the pre-work or the pre-activity before the event starts so that you are ready. And then during training, during training, you can expect an interactive experience. And so one of the things that we do also want to point out is that if you ever have technical issues with our training, whether it's connecting to the webinar itself, or whether it's something more fundamental, like your team doesn't have the right headsets or they don't have cameras, because our webinars and trainings are more interactive, if you don't have these things for your staff, do send us a note and we'll see what we can do. We want everyone to be able to participate at that level of interactivity. During training, you can also expect that we will connect concepts with real life applications. We want this material to be meaningful to your actual work. So this means that we'll also provide resources on the back end that will help you apply the training content in your professional setting. After training, we're still not done. At CalTrin, learning is not a one and done experience. The evidence tells us that to successfully learn, we need to continue to review, use, and add to our knowledge base. This means that you'll hear from us a few weeks after the training, and again, a few months later. These interactions might include asking you a few questions about how you're applying what you've learned, providing you with more reading or resources, or offering more focused opportunities to reconvene and discuss how's it going, or to take a deeper dive. Maybe you want to know more after you spend some time thinking about it. Like today, whenever possible, we do record our training, and it's available on caltrin.org, along with all of the related resources. These links will typically be provided within 48 hours of a training event, but even if you haven't registered for an event, you're always able to go out on our website and have a look around and have access to these resources. Again, they are free. So how does CalTrin decide what's going to be on the training schedule? We select or create training based on research, and we aim to provide curriculum and trainers that will support you to engage and think critically about each topic. We also understand the value of communicating and building relationships across organizations. So we're looking for opportunities for meaningful discussion and information sharing. Finally, it's important to us as your training team to provide a positive, supportive, and sometimes even fun training environment. CalTrin plans training within 4 pillars, which were developed with guidance from a program advisory committee comprised of OCAP staff and stakeholders from each region. You can see these pillars now on the screen. The first is evidence-based or evidence-informed service delivery. So this might include topics like protective factors, parenting education models, or assessment of client needs. The next is direct service delivery skills, and I'm actually going to talk about a few topics coming up on our schedule that fit into this category. The third is trauma-informed systems, and many of you have been joining us over the last 2 months for an amazing series that deals with topics within this pillar. And finally is management and leadership development. So this might include things like change management, evaluations and outcomes measurement, coaching and mentoring, or even basic supervision and management skills. So what are we planning right now for the next couple of months? We have a lot coming up, and I'd like to give you a brief overview. For all of the events that I'm about to talk about, registration is open now at caltrin.org. So this month, Dr. Melissa Bernstein is going to join us again for trauma-informed organizations. As I mentioned, if you haven't already joined us for an event in this series, I really encourage you to check out the recordings on our website. They'll be located in the trauma-informed systems area on our resource page. We're also extremely excited to have Dr. Bryant Marks of the National Training Institute on Race and Equity at Morehouse College It's going to be joining us on April 28th. It's a foundational training on implicit bias. It's meant for all staff. We do encourage you, if possible, to register your entire team for this training. It's really meant for everyone, and it's not one you'll want to miss. We will have leaders reconvene with Dr. Marks on May 12th for a much more specific training on how to mitigate implicit bias within your own organization. Because attendance at the first training is required for the leadership workshop, we will open registration for the leadership workshop at that time after the initial foundational training. But do go out and register for that training as soon as possible to make sure your team is able to participate. In May, we are starting an 8-week course on the Strengthening Families Framework Protective Factors. So the 8 weeks will spend deep dive time on each of the factors so that this training can provide an excellent foundation for all staff. In addition, we'll be offering a Protective Factors Leadership Roundtable at the end of the series. Also in May, Dr. Donna Beagle will provide interactive events on understanding poverty and providing poverty-informed services. These events are also geared for all staff and may really change the way you think about direct service delivery. You can find more information about the learning objectives for both of these events on our website and register your teams. Finally, we're super excited because we are in the process of planning our new learning management system, which will launch next month. This online professional development platform will be home to a variety of content, including self-paced courses in each of the 4 pillars. You'll begin to see information about this new training very soon. If you have ideas how you might be able to use the system to provide on-demand training for your team, please don't hesitate to reach out to us. I'm just having a look to see all the comments that are coming in. It's fantastic. Excellent. So that was a little bit about CalTrin, but why are we here today? It is April, which is Child Abuse Prevention Month. And it seems obvious, but why is preventing child abuse a priority? At CalTrin, our core mission is to support professionals working in child abuse prevention. But during Child Abuse Prevention Month, we do try to stop and reflect on this question. Why are we all working in this field? Why is this truly important? So let's start that discussion with a quick poll to see if we can put some data behind why your work in this area is so critical. So I'm hoping you can all see this, but the question, and if you can't, let us know. The question is, how many children received either an investigation or alternative response in 2019 in the US? And you can see as people answer, just looking at the choices on the screen, all of the options are in the millions. So even before we know the answer to this poll, the sheer size of this issue is evident. And then if you go beyond the data and you start to really explore the individual impacts on children and families, this data becomes far more meaningful. So it looks like we've got just a few more seconds here as people answer. We've got some good responses coming in. It looks like we've got a couple of responses in the lead. People are sort of between 4.4 million and 3.5 million. Looks like people know the numbers are going to be big. We've got a couple people dialing in to see how big. We've got a few more responses. All right, let's go ahead and end our poll. So it looks like this is a very on top of it group. The answer actually is 3.5 million. And 40% of you said 3.5 million. So the size is truly stunning when you think about this. If you put it in further context, this means that in 2019, there was an investigation or an alternative response for 47 out of every 1,000 children in the US. So this is something that truly does impact many, many children and their families and their communities. So the work that you all are doing is extremely valuable in terms of preventing child abuse. April has been designated. I'm going to back up a minute and we are going to go to the next slide. April has been designated Child Abuse Prevention Month in the United States since 1983. Annual observance is dedicated to raising awareness and preventing child abuse. Some of the things we've been hearing about this year across the state have included staff training, pinwheel plantings, flag raisings and proclamations, social media campaigns, and of course, our pandemic favorite, drive-through events. It's clear in looking at these things that the way we celebrate has changed over the last year or so, but people's ingenuity and their passion and their drive for making sure that there is a high level of awareness about this issue in their communities has been really evident as people have communicated with us about their plans for this month. If you'd like to, take a moment and just share in the chat what your organization is doing. I know that we've asked a couple of times over the last few weeks, but especially now that it is the first week of April, I think a lot of you will have a really great plan in place and we'd love to hear about it. So we're seeing pinwheels. What else? What is everyone doing? While you add those to the chat, I would like to just point out a presidential proclamation that was made in 2016 by President Barack Obama. The proclamation stated, during National Child Abuse Prevention Month, we recommit to giving every child a chance to succeed, ensuring that every child grows up in a safe, stable, and nurturing environment that is free from abuse and neglect. This seems like such a basic premise, but it's also one that so many of you are working really hard to ensure. And now we do see a bunch of these coming in. We've got, oh, I love the video of the virtual tour. That's a great idea, especially I think if you are a community resource like this, to really give people an idea of who you are in person. We've got virtual open houses, Wear Blue. It's been really fun to see everybody's Wear Blue photos this week. Informational videos, these are fantastic. And we will hope to capture some of these so that we can share them out to everybody. So this year, the Children's Bureau theme for Child Abuse Prevention Month is Thriving Children and Families, Prevention with Purpose. And you can find more information and theme materials on their webpage, which was included in the pre-reading for this webinar. But if you did miss it, it will be in the resources page that we send out on Monday, along with a number of other resources. And you'll also note that there is a larger list of Child Abuse Prevention Month resources at the back of your note-taking packet. Next in our presentation, I would like to introduce Jennifer Rolls-Roots. In her role at Rady Children's Hospital, San Diego, Jennifer is the director of the California Evidence-Based Clearinghouse for Child Welfare and the California Training Institute. These projects, funded by the California Department of Social Services Office of Child Abuse Prevention, support the needs of child abuse prevention and intervention organizations through evidence-based resources, professional education, and technical assistance. Jennifer was previously a research coordinator at the Child and Adolescent Services Research Center, or CASRIC. Throughout her career, Jennifer's work has focused on children receiving services through public sector of care, including the child welfare and mental health systems, with an emphasis on how to more effectively implement evidence-based practices in real-world settings. Following Jennifer's presentation, we'll turn it over to Jess, who will take a quick look at next steps to turn information into action. Jennifer?
Great, thank you. I'm very glad to be here. Thank you for having me. I'm really glad to share information on the science of prevention in conjunction with Child Abuse Prevention Month. So I'm going to start us off by doing a kind of a quick review of the CEBC for those who may be less familiar with it. The mission of the CEBC is to help spread the use of evidence-based practices within the child welfare system, as well as other child and family serving systems. And we have two main components, the program registry, which reviews programs, and an implementation section, which is all about how to select and implement the appropriate program for your needs. The website is the public face of our project. So I'm just going to see how many folks have actually been to the CEBC website already. You can go ahead and raise your hand in Zoom if you've already been there. I'm seeing lots of numbers, so great. I'm going to move through this quickly. If you ever wanted more detailed information on the CEBC, feel free to reach out to us directly, and we're happy to do presentations or technical assistance. So the CEBC updates the existing information regularly, and we add new program information and resources usually twice a month. So be sure to sign up for email alerts, which you can do in the email alert section on that green navigation bar. The CEBC gives information about the research evidence for the practices we review. That's what our rating is based on. But this is really not all the information you need to consider to determine whether something is an evidence-based practice. We've adapted our definition of an evidence-based practice, which you can see here, the 3 concentric circles, from the Institute of Medicine. So it is clinically focused, but it's still very applicable to child welfare. In place of best clinical experience, we're talking about your professional judgment, whatever your role is. If you're a child welfare worker, a family support provider, paraprofessional, parent advocate, whatever, what you think this family would need to benefit from, or what supports they would need to help them succeed. When we talk about consistent with family and client values, what this really means is learning and understanding what each family wants and what is important to them. And I often like to add in community values to this circle because I think it's also important to consider what's acceptable, what's expected in your neighborhood or in your region, or whatever particular population you're working with. So at the CEBC, we consider an evidence-based practice to be when all 3 of these overlap, both the research evidence, your professional judgment, and your family values and needs all come together. And in that case, that practice is considered an evidence-based practice for that situation, that family, that community. The CEBC examines the scientific evidence for each program that we review and rates it on a continuum from 1 to 5, where 1 stands for well-supported research evidence and 5 goes for a concerning practice. Moving between the ratings is like moving up or down a step, as shown here. So a program rated a 2 is kind of 1 step below a program rated a 1, and so on. If the program doesn't have any research evidence that meets the CEBC's requirements for rating, then it's considered NR, or what's called not able to be rated. And that's the blue box that you see at the bottom of the screen. It's really not on the continuum. We don't know much about it because we don't have enough research to tell you if it's working or not. One unique feature of the CEBC compared to other evidence-based registries is that we examine each program's relevance to child welfare. Again, that's our original target audience. We mark the program as high, medium, or low relevance to child welfare. Basically, we determine this by looking at things like, was it designed for child welfare and child welfare involved populations? Does it have a history of use and study in child welfare populations or in similar populations? So perhaps populations that have been referred to child welfare but screened out, something like that. So high, medium, low gives you a little bit of information about whether this program was designed for or has already been used in child welfare populations. The CEBC groups all of our programs in topic areas on the website. So if you haven't been, when you go, you can look for programs, and you can also look at topic areas and see all the programs that fit in that topic area. The topic areas are based on outcomes and the domain that's being covered. So examples would be depression treatment or alternatives to long-term out-of-home placement. So again, outcomes driven. We work with the program developers to fill out a detailed questionnaire. That's how all the information on the website gets completed. And then after we post the program, we re-review the program every other year at a minimum to keep the information up to date. We work with the developer to make sure the descriptive information is correct. And we also redo the research re-reviews for all the rated programs to make sure we haven't missed anything and that we're keeping the rating as current as possible. And on our website, you can see the date that each program was last reviewed on the bottom of the program page. Looking at this slide, looks like there were 524 programs on the website when I last updated the slide. It's gone up, I think, a little since then. That's okay. You can see the breakdown by rating. We've got a few 1s, a little bit more 2s, a lot more 3s. Not many 4s and 5s, which is good because that's stuff that didn't work or is harmful. And then a large number of not able to be rated programs. So again, programs that don't have research that meets our criteria. And it's about half the programs that we have on the CEBC fall in the not able to rated category. And this really hasn't changed over time. It's been pretty consistent, even when we had 100 programs, 300 programs, 500 programs. So there's a lot that's being used and relevant for child welfare that does not have a strong evidence base yet. Okay, enough about the CEBC. Let's get to the topic at hand, what you came for, the prevention of child abuse and neglect, and what the research tells us is effective. Let's do a couple basics to get us started. First, when we're talking about preventing abuse and neglect, those terms can refer to many different behaviors, but in general, there are 4 major categories of abuse and neglect that you'll see in data reports. The first is physical abuse, so physical force, hitting, kicking, shaking, etc. Sexual abuse, which could be inducing, coercing a child to engage in sexual acts, or other types of things, exposing a child to sexual activities and so on. Emotional abuse is behaviors that harm a child's self-worth or their emotional well-being. Things like name calling, shaming, threatening, withholding love, rejection, etc. All those things that are so harmful to the emotional side of a child's development. And then lastly, but not least, is neglect, failure to meet a child's basic physical and emotional needs. Could be housing, food, clothing, medical care, and so on. So probably most of this audience already knows that neglect is by far the most common abuse type that's cited in opening of child welfare cases. So about 75% of our cases have neglect as one of their abuse types. And actually about 15% of child welfare cases involve 2 or more types of abuse. Okay, so quite a range. I should note, I'll be giving the references at the end of the presentation for these statistics, as well as all the other data that I'll be presenting during this. So you don't need to jot it down. You'll get all the references and I think links to the documents themselves. Okay. This presentation, we're going to focus on 2 types of prevention, primary and secondary. Primary prevention is for the general population. It's universal programs, things that are designed to prevent abuse and neglect from ever happening in the first place. Primary prevention programs strengthen communities and improve child well-being by focusing on what's called the social determinants of health. These are the conditions in which people are born, where they grow, live, work, etc., and age and get older, as well as the wider set of forces and systems that shape the conditions of everyday life, all the stuff around us. Secondary prevention is more targeted, typically based on risk factors that are commonly associated with abuse and neglect. And the goal here is preventing abuse and neglect from occurring in these high-risk families, and doing that by building protective factors and mitigating those existing risk factors. Secondary prevention programs may be offered to populations that have 1 or more risk factors that are associated with child maltreatment or compromised well-being. And these are things like poverty, parental substance abuse, parental mental health concerns, exposure to violence, and parental or child disabilities. All right, now let's get to the meat of the presentation. What is the state of the science? So while the CEBC reviews specific programs, the Centers for Disease Control and Prevention, or CDC, has done a thorough review of research on strategies and approaches that impact child abuse and neglect, or the risk factors for child abuse and neglect. They examined multiple meta-analyses and systematic reviews, and these are basically kind of studies of studies, compiling evidence from multiple studies into one large study. They also look at rigorous studies like the CEBC uses in its review, randomized controlled trials, other versions of controlled studies, and so on. And what they found in their report, and again, you'll have the full link at the end, is that they identified 5 main strategies that are supported by research evidence for the prevention of child abuse and neglect. And we'll use these strategies as a framework for this presentation and go over the individual approaches for each in more detail. I'll give examples from the programs that are listed on the CEBC that fall under these when relevant, and we'll also talk about actions that can be taken at the local level for each approach. So taking a look at these strategies, they are things like strengthening economic supports to families, changing social norms to support parents and positive parenting, providing quality care and education early in life, enhancing parenting skills to promote healthy child development, and intervening to lessen harms and prevent future risk. as you can see, there are clear overlaps with common prevention frameworks like the protective factors when you look at these strategies. So as Dana mentioned, part of CalTrin's commitment is that after a training, you have both the know-how about a topic and a way to put that information into action. So basically, we want to take you all the way from idea through implementation. So here's a screenshot of a worksheet, which you've already gotten, or maybe they can, Jess or Dana can drop that link in the chat again so you can download it. You can use this to take notes, write down ideas that you have as we go through the presentation. You can focus on what are the things you're already doing, either as an individual or at your organization as a whole. And what are some of the suggestions, the ideas for things you could start doing, whether it's this month in honor of Child Abuse Prevention Month or throughout the coming year. All right, let's review each strategy in more depth. The first strategy is strengthening economic supports to families. And there are two underlying approaches with evidence, and those are strengthening household financial security and also family-friendly work practices. So we know that the socioeconomic conditions of families have a huge impact on their overall well-being. So this is an area that's ripe for intervention. So if you work in this area, go ahead and in the chat box, list some of the things that you're currently doing to support financial security for families and community. Okay. What are some of those current practices that you and your organization currently utilize to strengthen economic support for families? Let's see what people are currently doing. Okay, great. Thanks, Stacy. So I refer to state disability insurance and Family Medical Leave Act programs. Perfect. Let's see if we have any others. If folks are working in this area, partner with WorkNet. So working with outside organizations, rental assistance, food banks, etc. Great. Economic empowerment, government benefits. Excellent. So you guys are on the ball. Let's look at what the some of the concrete approaches that have evidence, many of which you've already covered there. Approaches that strengthen household financial security are a combination of both primary and secondary prevention. Some are universal, but many of these are targeted, obviously, at lower income families who are at increased risk and need a little bit more support. So yeah, great job with what you're listing, referrals to housing agencies, food assistance, homeless, food banks, and so on. So looking at what the research tells us, one of the first things are tax credits, which have been associated with a large number of positive outcomes, likely because they help lift families out of poverty. So while these tax credits haven't been tied directly to the prevention of child abuse and neglect, in addition to just reducing poverty, they have also shown positive impacts on infant mortality, health insurance coverage, school performance, and maternal stress and mental health problems, all of which are risk factors for child abuse and neglect. Food insecurity is a risk factor for child abuse and neglect. And nutrition assistance programs like CalFresh or SNAP, sorry, I'm going to use California names since I know we have a lot of California folks here and we like to rename things. So CalFresh, SNAP, both of these reduce the severity of food insecurity. They don't really change the probability, though, that families are food insecure. However, a study using administrative data found that among children enrolled in Medicaid, families receiving SNAP or WIC had fewer reports of abuse and neglect than families that did not receive SNAP or WIC. So both of those were effective. A couple other approaches. Section 8. So in general, Section 8 housing vouchers are associated with reduced psychological distress and depression. Not surprising, you help people get housing or access to housing, and it relieves some of that burden that you feel if you're struggling. And those are both risk factors for child abuse and neglect. Housing rental assistance that facilitates moving families to better resource low poverty communities has shown in a study that had 15-year follow-up that the children who moved to lower poverty neighborhoods before age 13 were more likely to attend college and went on to earn 30% more than those who did not move to these lower poverty neighborhoods. So what the reasoning here, what the action here could be is to encourage Section 8 housing to be better distributed throughout your region. Don't just don't just have all the Section 8 accepting housing in really low income neighborhoods, but help distribute that more equally. And that shows that there's really positive outcomes. Subsidized childcare is another way that we can strengthen household financial security. And studies of subsidized childcare have shown that states that are meeting the demand for childcare assistance, that is, there's no waiting lists, have decreased rates of child abuse and neglect. And in addition, neighborhoods with more licensed childcare spaces relative to childcare need, so again, sufficient quantities, had lower rates of child abuse and neglect. Access to affordable childcare also reduces parental stress, and we know that having access to high quality childcare is associated with fewer symptoms of maternal depression. And obviously, both parental stress and maternal depression are risk factors for abuse and neglect. All right, the last one is related to child support payments. So we're all probably familiar with child support payments, where a non-custodial parent is paying to support their child. One thing that we can do is encourage parents to apply for child support from non-custodial parents, and also work with our states to ensure that child support funds does not decrease other payments that families may qualify for, such as TANF or CalWORKs. And this is actually common in some areas. They'll subtract the child support payment from the other benefits. So why do we want to do this, not have them reduce? While household income for low-income families increases when the full child support is passed on to families, research also shows that this policy increases the likelihood that non-custodial parents who contribute child support will do so in greater amounts. Basically, when the non-custodial parent knows that that full payment is going to the child, they're actually more likely to pay regularly. Also, a statewide randomized controlled trial of mothers entering the TANF program compared those receiving the full amount of child support from the non-custodial parent, or this was the intervention group, the full support, with mothers who only received a portion of the amount because the state was taking parts of it. What they found is that the children of mothers in the full amount group were 10% less likely to have a report of child abuse or neglect that was investigated by CPS. Child support passed on to families may also reduce family conflict, as well as mothers repartnering with someone who is not the child's biological father, both of which are risk factors for abuse and neglect. So what can we do, all of us as individuals or as organizations, to promote this strategy and the associated approaches? The primary action that we can all take is to personally learn more about these programs and how to access them. What's available in your state or community? How do people sign up for it? One thing to ask yourself, and possibly as an organization to think about, is how do you know when families need this assistance? Do you assume that everyone does, offer information to everyone? Do you ask everyone? So on. It's important to get information out broadly so that it just becomes part of your normal work and conversation to address household financial security. Posting flyers in waiting rooms and elevators may work a little less well during the pandemic if your office is not open, but you can share information on social media through your mailing lists. You can make sure that things are in intake packets, that you're adding items to your intake assessments or your periodic assessments, and so on. You can also offer trainings on how to apply. And there are public agencies and nonprofit groups that will come and do the presentation for you. Currently, they'll do them over Zoom. And you can also offer help with signing out, filling out forms. Again, maybe a little trickier in COVID times, but actually helping clients fill out forms, address the barriers they're having. And then lastly, of course, we want to be encouraging our lawmakers to support and expand these efforts so they can help more families. And we've certainly seen an expansion during the pandemic of financial security programs, which I think have really been of benefit. So hopefully some of those will continue a little bit longer. Let's move on to the next approach, which is family-friendly work policies. This is primary prevention because it affects all workers. These approaches benefit everyone, not just those with children in the household. So people on this call who don't have kids are probably, hopefully, benefiting from these as well. So the three examples that have evidence include livable wages, paid leave, and flexible and consistent schedules. Let's talk about each of those a little bit more. Livable wages are often tied to minimum wage efforts, which are very big in California right now. As we know that in many places, you cannot live decently or support a family even working full-time on the current minimum wage. Livable income has been associated with improved school performance and graduation rates among children, a reduction in hospitalization rates, particularly for injuries, and a reduction in physician visits, especially for mental health needs. We also need to ensure that people can take time off from work when they need and still get a paycheck. It shouldn't be a choice between taking a sick day and buying groceries or paying your rent. This is especially critical for new mothers, as we know that early bonding and breastfeeding are important predictors of later positive outcomes. However, not just mothers, everyone needs to be able to take a sick day or get some downtime occasionally. Research shows us that paid maternity leave in particular increases the frequency and duration of breastfeeding, which in turn is potentially protective against child abuse and neglect. Paid family leave, things like Family Medical Leave Act, is also significantly associated with reductions in hospitalizations for abusive head trauma. Again, that's something that you typically see in younger children, so shaken baby syndrome, and we're seeing that having paid family leave actually reduces reports of this abusive head trauma. Paid sick days and paid vacation are also associated with lower rates of depression and stress, again, both of which are risk factors for child physical abuse and neglect. Lastly, predictable schedules, which don't change from week to week, reduce stress in general, but even more so for parents who need to be able to plan ahead for childcare and other needs. When the daily timing of work schedules is irregular and unpredictable, parents often have difficulty securing consistent and quality childcare. Your schedule changes every week, makes it much harder. Flexibility, whether in work start and end times, the ability to work remotely, as many people are doing now during the pandemic, or the ability to work part-time if needed and then go back to full-time later on, are also key. Flexible and consistent schedules are associated with lower rates of depression and stress, again, both of which are risk factors for child abuse and neglect. So just for curiosity's sake, let's see how widespread these are. So in our group, raise your hand in Zoom if your employer offers all three of these family-friendly work policies. So livable wages, paid leave, and flexible, consistent schedules. Good to see. I see the numbers going up, so we got a decent number of people, and I know my organization does, so I'm happy to have that. All right. So what actions can we take? First thing, obviously, we can do is offer these in our own agencies. And based like the hand raising, it looks like we're doing pretty well. I'm sure there are some organizations that are doing this, others aren't. Maybe you've got 2 out of 3, et cetera. So we can encourage them in our own agencies, ensure that if you have subcontractors for your work, again, that you are encouraging all 3 of those to be available. You want to encourage lawmakers to support and expand these efforts. So some of these things are driven by legislation. So let's make sure that lawmakers know that these things are priorities. And then finally, you've probably seen ratings of national companies where, this is the best place to work or the best place for moms. You could do something similar at the local level, perhaps during Child Abuse Prevention Month or throughout the year, and publicly recognize those who are meeting these goals already or who are moving in the right direction. So let's come back to that worksheet and give an example of how you might be using it as we're going forward during the presentation. Using the strategy we just covered, strengthening economic supports to families, you could identify an action that you can take as an individual, such as to learn more about how to apply for CalFresh, what the requirements are, what the process is, and write that down in the 3rd column. Just jot a note. As an organizational approach, you might want to add information to your existing resource packets about the Earned Income Tax Credit, both California and state, and perhaps designate a specific month in which all staff get the word out to their families, whoever's on their caseload or they're working with, about what it is and how to get it. And I would say designate a month because, for example, in this case, earned income tax credits related to filing your taxes, you typically do that once a year, and so on. So again, this is just a way for you to take some notes and help think about what the takeaways, the action items might be. Okay. Second strategy is changing social norms to support parents and positive parenting. And the 2 underlying approaches that have evidence here are public engagement and education campaigns and legislative approaches to reduce corporal punishment. This is true primary prevention. It's really what we call a public health approach, and you're trying to make change at the community level. So thinking about this first one, public engagement education campaigns, if you have been familiar with any of these or seen success with any of these, go ahead and enter some of the names of programs or description of the programs that you had involvement with into the chat. So public engagement and education campaigns. So what we see, okay, safe sleep. Yep, perfect. What we see here, we see another one, breaking the cycle. Public engagement and education campaigns use something called social marketing techniques, and they've been used effectively in public health to change behaviors, and specifically for behaviors related to child abuse and neglect. So let's just go through these. Social marketing, mass media or social media campaigns, town hall meetings that might target specific neighborhoods or communities, and then something called bystander approaches. These are approaches that teach and encourage people to speak up and intervene when they see abuse or neglect occurring. So this is kind of like, you know, the see something, say something campaigns that we're seeing. So, okay, so thanks for the folks that put that on. Be safe, nurturing parent program, credible years. Yeah, good touch, bad touch. All examples of things that you can do that have components. So these types of interventions are working. These are community level. So this would be trying to get out to everybody in the community to change community thinking. One study of a campaign showed that up to 44% of parents in the campaign area had contemplated changing their behavior, and up to 16% had actually tried to stop yelling at, swearing, or putting their children down, and fighting or arguing in front of their children. So these parents were actually reporting that just from seeing billboards or hearing news ads, they were trying to change their behavior. So great. Another study, a pre-post comparison of a different campaign, found that positive parenting showed an almost 20% increase. Okay, sorry, a campaign focused on positive parenting showed a 20% decrease in the stigma associated with parents needing help with parenting. We know that it is often hard to work through and help folks to ask for help, so this helped decrease that. All right, I'm going to move us along because I know we are getting close to the end of the time. Here are a couple examples of campaign graphics. Broken kids can't be placed. It takes a hero, be a hero to a child who needs your help, and so on. So thinking about your actions, this is really social media, public campaigns. This can be a great way to use interns or volunteers, work with schools, health providers, target large companies, etc. And in terms of what's on the CEBC, we have two examples. Triple P, Positive Parenting Program, has a universal model, and Strong Communities for Children. These are both universal campaigns. Okay. Legislative approaches to reduce corporal punishment. This is really working to prohibit corporal punishment in areas that are licensed, like schools and daycares. And studies in Europe, where these sorts of policies are more common, have shown that these are effective at reducing both use and support for corporal punishment in general. So in addition to learning about existing laws in your state, you can encourage change in the law through a campaign, letter writing campaign, email campaign, perhaps as part of Child Abuse Prevention Month. The third strategy is providing quality care and education early in life. And again, there are two approaches for this. And these are primary and secondary prevention, kind of depending on. So let's kind of move through these. First one is preschool engagement. Preschool enrichment with family engagement. So we know that preschool for all is a common saying. Quality preschool should be available for everyone, not just those families who can afford what's very often a high cost. Publicly funded options typically focus on economically disadvantaged children, and we can see a lot of impact here. But in general, all early childhood programs would benefit from incorporating more parent support and educational opportunities for parents. These types of programs have shown positive impacts on both the child's cognitive skills, school achievement, as well as social skills and conduct problems, and are effective in reducing child abuse and neglect. And the one of the options that's on the CEBC is something called Early Head Start, which you may be familiar with. And when you're looking at these, examine the options that are available in your area. Think about things like locations. Are these services located near transit, employment centers, in appropriate neighborhoods? What's the admission criteria? How tight are the restrictions to get in? Are they reasonable, or are too many families being excluded? And then are there wait lists in place? And if so, how long are they? The second approach is improving quality of childcare through licensing and accreditation. So this applies to all childcare settings, both publicly and privately funded. And we've got a link here to the current national standards if you want to look at them in more detail. Accredited childcare, which ensures a minimum quality of care, is associated with positive outcomes for children, particularly in abuse and in reducing behavior problems. And other research shows that quality childcare can also counteract the effects of a lower quality home environment. So a little bit of support there. So how do we support this approach? Again, learn about what the requirements are for licensing in your area, your state, or local, and encourage those to become in line with the national standards. Also determine which providers in your area are accredited and recognize them, gold stars or a social media campaign. Encourage other providers to get accredited. Find out what the barriers are to accreditation in your area, if any, and see how you can help address them. Beyond accreditation, you can also improve educational opportunities for childcare providers in general. If you offer free trainings, include childcare providers in your mailing list so they can attend. Partner with your community colleges or other local educational organizations to offer and market training to childcare providers, and develop a resource list of free online options that they can participate in. There are so many live and recorded webinars available online, especially during the pandemic, that are open to everyone. The fourth strategy is enhancing parenting skills to promote healthy child development. These approaches are primary and secondary prevention with the goal of increasing parenting skills. So home visiting is a classic approach to child abuse prevention. And I'm going to imagine that many of you have been involved in home visiting. So if you have, go ahead and raise your hand in Zoom. Take a look at that. Okay. So yeah, got hands going up. Thank you. Many people learn how to care for children from their own parents and other relatives, but not everyone has that resource, or maybe their own parents never really had the skills themselves. So early childhood home visiting programs ensure that all people have a minimum core set of parenting skills, even if they don't have a social support network to teach them or help them. They're typically targeted at higher risk groups, but some jurisdictions target entire neighborhoods or offer check-in and phone call support to all parents. Providers can vary widely by the specific model used. The evidence of child abuse prevention effectiveness for home visiting programs is mixed, with some models showing few or no effects and others showing strong effects. These mixed effects likely arise because of the content of home visiting models, which varies. Not all home visiting programs specifically target child abuse prevention. Some are more focused on overall child well-being or on school readiness. So it looks like we've got some folks that are putting in here about different childcare info. Thank you. I think that's Michael. Thank you for sharing that. Okay. So here are some examples of actions. Again, learning what's available in your area. Home visiting is not a one-size-fits-all approach. So if different models are available in your community, you may want to refer families more specifically. And here I've got some examples of things that are on the CEBC, Nurse Family Partnership, Safe Care, Child First, and Exchange Parent Aid have all been shown effective at reducing and addressing abuse and neglect. We have a handout from the CEBC. That's basically a topic area summary on home visitation for child abuse and neglect. And I think that'll be in the resource package, or perhaps we can drop that link into the chat. Next approach is parenting skill and family relationship approaches. These are things that teach behavior management and positive parenting skills and support parents and caregivers. They can target parents in general or focus on parents of a specific age, such as toddlers or teenagers. So again, different parenting needs. Parent skill training approaches have consistently demonstrated positive effects in preventing child abuse and neglect, including reductions in the use of harsh verbal and physical discipline, including spanking and hitting, as well as an increase in nurturing behavior and the use of positive parenting strategies. So if you've worked with any of these types of models in your work, go ahead and drop those into the chat too, so we can see what people are using. And really what we can do here to take action is to think about what's available in your area. Learn what the different options are. It's not one size fits all, so you want to assure that you have offerings for all age groups, different needs, and so on. And some of the programs that are on the CEBC in this approach would include the ACT Raising Safe Kids program, the Effective Black Parenting program, and Incredible Years, which you may be familiar with. So the fifth and final strategy is intervening to lessen harms and prevent future risk. These are secondary prevention. So we're trying to intervene early to reduce long-term effects. Enhanced primary care, the first approach sounds complicated, but it's basically using healthcare providers as an extra set of eyes and ears and a way to reach families under stress early. This is especially key in infants and toddlers who are usually seen regularly by doctors and are also at a higher risk of abuse and neglect. Basically, assessing family strengths, needs, and stresses becomes a standard part of the medical visit, and the healthcare provider intervenes if there are any red flags. However, to succeed, clinicians need to have clear referral pathways. If they identify an issue, they need to do something to assist and then follow up with the family to see how they're doing. And you can use social workers or paraprofessionals for this in order to decrease the time burden on clinicians. So these programs have demonstrated positive effects on child abuse and neglect, including fewer reports to Child Protective Services and fewer occurrences of severe physical assault. And if you've been involved in any programs like this, these sorts of enhanced primary care, go ahead and raise your hand so we can get an idea if people are doing them. Okay. So taking action here, great. So there's at least a few people who have worked in this area. Taking action here can be informal and involve outreach to your local medical community, or it could be adopting a more formal intervention model, such as these two that are listed on the CEBC. The next approach is behavioral parent training programs. Again, we're targeting the parent, but in this case, it's not general parenting skills like with those home visiting and child development programs we talked about, but it's more of an intervention or early intervention when disordered parenting is happening. So these programs have demonstrated success in preventing recidivism for abuse in families with substantiated child abuse and neglect cases, and in reducing child abuse and neglect risk factors in higher risk families, such as those who are using harsh or maybe punitive parenting practices. Outcomes have included fewer re-reports of abuse and neglect, reduced child conduct problems, reduced harsh parenting, and increased use of positive discipline and nurturing parenting. So these programs can address one individual family at a time, or they can be group-based, and they can differ on the child's age, since the skills a parent needs to parent a 2-year-old are very different from those needed for an 8-year-old or a teenager. And thank you for folks that are putting some examples in, positive discipline association, et cetera. You can take action by learning about what's available in your local community, and be sure that these types of interventions are different from the universal basic parenting skills training that we discussed in Strategy 4. Parents who have these issues need additional work. It's not just your old traditional educational program. And again, examining factors: where are programs located, how can they be served, how many can be served at a time, how are they delivered, and so on. The CEBC has several behavioral parent training programs that have been shown to reduce abuse and neglect, including Alternatives for Families, a cognitive behavioral therapy, Combined Parent-Child Cognitive Behavioral Therapy, and Parent-Child Interaction Therapy. So you'll notice they're therapeutic pretty much across the board. The third approach in this strategy, treatment to lessen harms of abuse and neglect exposure, is really targeted at the child. Treatment, again, is therapeutic. It can be offered in individual or group settings, and it can focus on the child only or also involve the parent, especially with younger children. Research has shown that treatment for children and families to lessen the harms of abuse and neglect exposure is effective in reducing symptoms of post-traumatic stress disorder, depression, and behavior problems. Other research has suggested that post-treatment improvements in trauma-related symptoms for the child, things like depression, fear, anxiety, shame, etc., are sustained at 6 and 12 months after the end of the intervention, as are parent improvements in parent-related behaviors and parent emotional distress and depressive symptoms. Okay, so here's a couple of examples of things that are on the CEBC that fall in this area: child-parent psychotherapy, prolonged exposure therapy, TFCBT. Thank you, Jess. I'm sorry I'm going over. Goodness. It's very important that we always consider the emotional and mental health needs of children who have experienced abuse and neglect. Just because there's no physical injury does not mean that the child's psychological safety and sense of security hasn't been significantly impacted by their experience of abuse, neglect, witnessing, etc. Emotional abuse and neglect can have profound impacts on children, and even events that occur at a young age, infants, toddlers, can have a lasting impact if they're not addressed with a therapeutic intervention. There are interventions that help, and we need to make sure that they're being used and are available for every child who needs them. Children who've experienced trauma can be misdiagnosed if the right questions are not asked. And you can end up going down a treatment pathway that's not necessary and even harmful. So it's very important that we ensure that our providers are trained and educated on how to work with children who've been abused. So in the chat, if you have worked with this population, go ahead and put in some of the behaviors that you've seen in children who've experienced trauma that can be misinterpreted as something else. And so, for example, inattention in school sometimes gets identified as, ADHD, but could it just be that the child is distracted because there's things going on at home that are interfering with their ability to engage in school? So thank you, Sherry. Withdrawal, violence, biting. I mean, yes, there are so many different behaviors, and we need mental health providers who really understand those so that, yes, Alicia, that we're not diagnosing these as conduct disorders, that we're thinking about trauma that could be causing these. So in general, we need to screen better for trauma and educate those who work with kids better so they understand that trauma can result in a wide range of behaviors and how best to respond. And this isn't just clinicians, this is childcare providers, preschool workers, school staff, et cetera. Anyone who works with kids really needs to have a better understanding of how trauma can impact on child behavior. The final approach is intervening with children who've been abused and neglected to prevent current and future behavior problems. So once the abuse has occurred, how do we help that? How do we help prevent future problems? Specifically focused here on behavior, acting out, conduct disorder, and so on. So studies have shown that these programs have small but significant effects on things like delinquency, mental health disorders, substance use, out-of-home placement, and other family and peer factors. Typically, these interventions involve parents and caregivers. Sometimes the entire family network or social community can get involved, and they can involve both individual and group components. So several examples on the CEBC include children with problematic sexual behavior, cognitive behavioral treatment program, that was a mouthful. This program has shown significant reductions in reoffending and child sexual behavior problems, and also non-sexual offenses showed no difference from a general mental health clinic sample, so that was a positive outcome. MST has been widely studied, and they also have a newer model that's specifically targeted at child abuse and neglect. Doesn't have quite the same level of evidence as the regular MST, but it may be worth consideration. And lastly, TFCO is a family-based placement for adolescents that has had great results as an alternative to residential care and actually incarceration. It used to be called multidimensional treatment foster care, or MTFC, and they changed their name a few years ago. Okay, so similar to these other approaches, take action by learning about what is available in your local community and ensuring that any treatment programs for this population are evidence-based and trauma-informed. Also look for programs that are certified by the treatment developers so that the providers were properly trained, and ask whether booster trainings and fidelity assessments are used to ensure the quality of services. Again, examine factors such as where the programs are located, how many families can be served at a time. Most of these interventions have very small caseloads, 6 families, 4 families, et cetera. So you want to make sure you have sufficient breadth to address the needs of the number of families in your community who could access these services. All right, that was a lot to cover. I know we're getting close to the end. If you have questions, go ahead and put them in the QA box. If we don't get to them today, we'll try to get to them over email. I've listed a lot of different examples of possible evidence-based practices and approaches. So a common question we get at the CEBC is, how do you know which program to select? The CEBC can be a helpful resource as you review programs and make decisions. The CEBC program registry gives you information about the scientific rating, but also a lot of other information about each program to help you determine what's the best fit for your needs and community, including things like program goals, essential components, required resources, and training requirements. You can also compare multiple programs at the same time by selecting them on the website. We have an entire section of the website that's about selecting and implementing programs with concrete tools and worksheets that you can apply locally. We also have an entire guide that you can download for free from the website and work through on your own. So let me give you an example of how we've used that. We had an agency that was looking for a parent training program to include in an upcoming proposal. We worked with them using both the downloaded guide and 2 phone calls to identify what the goals were for the parent training program. We discussed what they'd already been using and how it had gone. And we learned about the local community needs. What's the population they're trying to address? Who are the providers they have, and so on. So they were able to identify 2 potential parent training models, which they then did some additional work with, including some stakeholder discussions and calls with the program developers. And then lastly, checked references, talked to other agencies who use those models, and then they made a final decision on which model to select. So all of these tools are available in the guide, just requires working through them. And if you're in California, the CEBC is also able to help via phone or Zoom. So before I sign off and give this back to Jess, one very important last point, the power of connection. So we know how important it is for our families to be connected, social support networks. We've talked about that in a lot of these approaches, increasing that feeling of connection. But it's also very important for us as professionals, as providers, to have that connection. So it truly takes a village, takes all of us to prevent child abuse. You cannot do it on your own as a single person or a single organization. And Child Abuse Prevention Month is great. You can take the energy that we've all got from this month to help build something that will last us year-round. If you work in the child abuse prevention field, it's crucial to work with other local partners. The prevention solutions that we've been talking about really need to involve multiple agencies, different funders, and often legislatures, government officials, so way beyond the capacity of any one person or one organization. And I truly believe, I love the word synergy. We can accomplish so much more working together than working as individuals. So we need to connect and collaborate regularly as professionals to be successful. And the other thing that it will do is I know whenever I connect with individuals and other organizations, it's so restoring for myself to talk to other people who are doing the same work and hear and share and just support one another. So what can you do? What if you aren't well connected with other organizations and providers currently? First thing you can do is get involved in your county's Child Abuse Prevention Council, or what's called a CAPC here in California. If you're already involved with those, go ahead and raise your hand if you've attended one of the CAPC meetings in the past 3 months. I would imagine I have. I would imagine that states have something similar, probably called something different. If you have no idea what your CAPC is or when it meets, you can find a link on the OCAP website. So the link is right there. Go there and it'll tell you what's operating in your area. Similarly, if you're a family resource center or you're working in the family support field, network with other providers at both the local and state level. The California Family Resource Association, or CFRA, can help you identify networks that are active in your area and support you if you want to establish a local network. Okay, and so I've got their link there as well. And then finally, this new e-guide, which is also available on the OCAP website, is a great way to identify key local players. It's organized by county and has detailed contact information. Use it to reach out to local players and see how you can partner with them. I think it just came out within the last month or so. All right, so it's time to wrap up. We probably do not have time for questions, so I will try to get to anything that's come in over email. Here are the key references for the presentation. Again, they're on the resources document that you'll be getting. Here is some information about how to reach the CEBC. If you have questions, you can contact me directly at info@cebc4cw.org and sign up for our email alerts.